Every 40 seconds, someone in the world dies from a complication tied to uncontrolled blood pressure. 40 seconds. That's roughly the time it took you to tap on this video, get comfortable, and start listening. And if you're over 60, or you're caring for a parent or spouse who is, please give me your full attention for the next few minutes. Because there's a deep confusion in this country about what the right blood pressure actually is for an older adult. And that confusion is quietly costing lives every single day. I'm a physician with nearly 20 years of clinical experience, and one of the questions I hear most often from patients is exactly this. Doctor, what should my blood pressure be now that I'm past 60? And I'll give you the honest answer right up front. It's not the same number that's right for your 30-year-old son or your 20-year-old grandson. And this is one of the most common sources of medical error I see in everyday practice. Stay with me through the end because I'm going to walk you through the 5 most serious mistakes older adults make when managing their blood pressure, ranked from the least dangerous to the most dangerous. And number 1, I can tell you with confidence, may surprise you, because there's a good chance you or someone in your family is doing it every single day without realizing it. But before we get into it, I need to be straight with you. The title of this video asks what the best blood pressure is for older adults. And I want to explain this carefully, because my commitment to you is medical truth, not hype. There's no single magic number that fits everyone over 60. What we have are safe ranges, supported by large clinical trials, that need to be adjusted to each person's clinical situation. And that's exactly what I'm going to break down for you now. Let me tell you about Mrs. Dorothy. 72 years old, born and raised in Asheville, North Carolina. A homemaker her entire life, mother of 5, grandmother of 11, a woman of faith, a woman of quiet strength. She came into my office one Monday morning, brought in by her daughter, with a home reading of 170 over 100. Her daughter was anxious, and Mrs. Dorothy looked at me and said, "Doctor, my last physician told me I had to bring it down to 120 over 80, but I keep falling. I've already hit my head twice." And here's the point that almost nobody talks about on the morning shows, in the magazines at the grocery checkout, or in the casual advice we hear from friends. The blood pressure that's healthy for a younger person can actually be dangerous for someone Mrs. Dorothy's age. Not because her body is broken, because her body has changed. And good treatment has to keep up with that change. Let me explain it in plain terms, because this concept matters more than almost anything else I'll share today. Think of your arteries like the streets of a town you've lived in for decades. When you're 20, 30, 40 years old, those streets are smoothly paved, flexible, easy to drive on. The pressure needed to move traffic through is low. Now, with the years, those same streets start to harden. The pavement gets stiff, cracked in some spots. So, for blood to keep reaching the most distant places, especially the brain and the kidneys, the heart has to push a little harder. That's part of the normal aging of the arteries. Lowering blood pressure too aggressively in that situation is like turning down the water pressure in the old pipes of a tall apartment building. What happens? The water simply doesn't reach the top floor. And that's what causes the older adult to fall. That's what brings on dizziness when standing up from a chair. That's what, in some cases, may contribute to faster cognitive decline. Because the brain, all of a sudden, is getting less blood than it needs. Now let's get into our countdown. The 5 most serious mistakes in blood pressure management for older adults, from least dangerous to most dangerous. Mistake number 5 is taking your blood pressure carelessly. It sounds minor, but it's not. A study published in the journal Hypertension from the American Heart Association found that more than 70% of readings taken in clinics or at home are technically incorrect. The person took it right after a cup of coffee, took it with a full bladder, took it with the arm dangling at the side, took it while talking, took it with a sleeve rolled up tight around the upper arm. Each one of those small details shifts the number that shows up on the monitor. And then the doctor, or the patient, reacts to a false number. A medication gets increased that didn't need to be increased. A pressure that was already fine gets pushed lower. Think about that. How many important medical decisions have been made in the life of your father, your mother, your grandparents, based on readings taken any old way? Mistake number 4 is putting full trust in the wrist monitor, the one that looks like a wristwatch and seems so convenient. Older adults often pick those up at the pharmacy because they're easier to use. But most of those devices, especially the budget ones, simply don't have the accuracy of a proper upper arm monitor. A review in the Journal of the American Medical Association looked at dozens of these models and concluded that the margin of error is large enough to compromise clinical decisions. In plain terms, the device says 170 when the real reading is 140, or the other way around, and the person ends up living on an emotional roller coaster that has nothing to do with what's actually happening inside their body. Before we keep going, I'd like to ask you something. If this content is helping you, if you're learning something that may protect your health or the health of someone you love, please tap that like button right now. That simple action helps this video reach more older adults and more families who are lost in the confusion around blood pressure. And if you haven't subscribed to the channel yet, do that now and turn on the notification bell. And let me know in the comments what city or state you're watching from. I love seeing where this community is growing. Coming back to our list. Mistake number 3 is following the same blood pressure target for every older adult without considering individual conditions. And this mistake is one of the most harmful I see. Let me introduce you to Mr. Henry, 68 years old, retired contractor from Birmingham, Alabama, a strong man, widowed for 6 years, living with his youngest daughter. He came into my office after a fall in his bathroom at home. He fractured his hip. His daughter told me he was on 5 different blood pressure medications. 5. And his blood pressure, when they checked it at the hospital, was at 100/60, a very low pressure for a 68-year-old man with stiffened arteries. He told me, "Doctor, for the past year I haven't been able to climb the stairs in my own house. I get dizzy. I just figured it was old age." It wasn't old age. It was over-medication aimed at the wrong target. Recent studies like the well-known SPRINT trial and the more recent STEP trial have shown that lowering blood pressure too aggressively in frail older adults, in those with a history of falls, in those with early cognitive issues, may increase the risk of falling, may increase the risk of acute kidney problems, and in some cases may contribute to faster cognitive decline. That's where the real danger lives. For most adults over 65 in good general health, a reasonable target tends to sit between 120/80 and 140/90. For frailer older adults with multiple conditions or a history of falls, the target may be more permissive, between 140/90 and 150/90. This needs to be individualized. This needs to be discussed with your physician. It's not a copy and paste from an outdated reference table. Mistake number 2 is stopping the medication on your own when blood pressure looks fine. And this one is one of the most treacherous I encounter. A person checks their blood pressure for 3 days, sees 120/80, and thinks, "I'm doing great. I don't need this anymore." They stop the medication. Within a few weeks, the pressure climbs back up, often higher than before. It's what we call the rebound effect. A meta-analysis published in the European Heart Journal found that unsupervised discontinuation of blood pressure medications in older adults was associated with a nearly 40% higher risk of serious cardiovascular events over the following 6 months. Roughly 1 in 5 older adults who stops these medications without supervision is likely to have a serious problem in that window. Sounds small? Look at the scale. If on your block, in your family, at your church, there are 10 older adults doing this, 2 of them may suffer a serious event. That's the real arithmetic. And here, I have to share something that weighs on me as a physician. What hurts me most in everyday practice isn't seeing the patient who arrives with uncontrolled blood pressure. It's seeing the patient who comes in after a stroke, after a heart attack, who looks at me and says, "Doctor, I felt so good that I thought I didn't need the medication anymore." I've heard that sentence hundreds of times, and every time it lands the same way. Now we've come to what I consider the most important point. Mistake number 1 in blood pressure management for older adults. And I saved this one for the end because it's the one that happens most often, and it's the one we talk about least. Mistake number 1 is ignoring blood pressure measured while standing up. That's right. The blood pressure sitting down looks just fine. The patient comes to the office. The reading is taken sitting down. The number looks good. 130/80. The doctor says everything's in range, but nobody measured the blood pressure standing up. And that's where the older adult's body reveals what's really happening. When we stand up, gravity pulls blood downward. A younger body compensates within seconds. An older body, especially one on too many medications, sometimes doesn't compensate well. The pressure drops. It drops suddenly. Sometimes it drops 20 points, 30 points. That's called orthostatic hypotension. And it's one of the leading contributors to falls, hip fractures, and head injuries in older adults across the country. Data from the National Health and Nutrition Examination Survey, and from research supported by the American Geriatric Society, show that nearly 1 in 3 older adults over 70 has some degree of orthostatic hypotension, and the great majority have never been formally diagnosed, because the doctor measured only sitting, or only lying down, almost never standing. Notice this detail. Most of the hip fractures I see in the emergency department in older adults don't happen from a stumble out on the street, from a car accident, or on a long staircase. They happen at home, in the bathroom, in the hallway, getting up from bed in the middle of the night. And almost always there's a similar story. I stood up, my vision went dark, and I fell. That's not just aging. That's blood pressure crashing because the body received too much medication aimed at the wrong target. All right, now that you know the 5 mistakes, I want to walk you through what actually works for safe blood pressure control after 60. Because information without action doesn't change anything. The first change is in how you measure. Always use an upper arm monitor, not a wrist one. Take the reading after 5 minutes of complete rest, sitting down, with your back supported, feet flat on the floor, arm resting at heart level. No talking, no crossed legs, no measuring right after coffee, a cigarette, or a walk. And take the reading at least 3 times, with 2 minutes between each one. The average of the last 2 is your real value. This simple change alone can correct around 70% of false readings. The second change is checking your blood pressure while standing up, at least once a week. Stand up, wait 1 minute, then measure. If the systolic pressure dropped more than 20 points compared to the seated reading, or if you felt lightheaded, that's a sign of orthostatic hypotension. Bring that to your physician. This standing measurement is the most underrated piece of information in older adult care. Think about that with me for a moment. 1 extra reading per week, taken standing, may literally help prevent a hip fracture. The third change is having a conversation about an individualized target. Don't settle for being treated like a textbook number. Ask your physician, "Doctor, given my age, my conditions, my history, what's my safe blood pressure range?" For some, it'll be 120/80. For others, 140/80. For others, 150/90. And that's perfectly fine. What shouldn't happen is being medicated until you fall. The fourth change is your diet. And here I want to be very direct with you. Cutting back on salt matters, but it isn't the whole picture. Increasing potassium is nearly as important. Potassium is found in bananas, avocados, sweet potatoes, beans, leafy greens like spinach and kale. A study published in the New England Journal of Medicine found that replacing regular salt with a lower sodium, higher potassium alternative was associated with about a 14% reduction in cardiovascular events in older adults with high blood pressure. One important note: older adults with advanced kidney disease should not increase potassium without medical guidance. Always speak with your physician first. The fifth change is movement. A daily walk of about 30 minutes 5 days a week has been associated with meaningful reductions in blood pressure in older adults. With research supported by Johns Hopkins University and the American Heart Association, showing average drops of 7 to 10 points in systolic pressure. And the beautiful thing is that this effect doesn't come from a pill. It comes from the body reorganizing itself. The calf, that muscle in the back of your lower leg, works like a second heart. Every step pumps blood back toward the heart and may reduce the load on the system. Let me tell you how Mrs. Dorothy's story ended. We took our time and reassessed everything. We removed one of the 5 medications she'd been taking. We adjusted the dose of 2 others. We set a new target, individualized for her, between 140/80 and 150/90. We taught her daughter how to measure the blood pressure standing up once a week. And 3 months later, she walked back into my office smiling and said, "Doctor, it feels like something shifted on the inside. I'm not falling anymore. I went back to Sunday service." That sentence to me is worth more than any test result. Let's recap what we learned today. The best blood pressure for older adults is not a single magic number. It's a safe, individualized range that takes into account your age, your clinical conditions, and your history of falls. Avoid the 5 mistakes: measuring carelessly, trusting a wrist monitor, following targets meant for younger adults, stopping medication on your own, and ignoring standing blood pressure. Build in a potassium-rich diet, daily movement, and close follow-up with your doctor. And whenever you're considering any change to your treatment, talk to your physician first. That's a rule that never changes. Your body, after 60, is not a defective body. It's a wise body. It spent decades learning how to balance itself. All it's asking from you now is that you listen a little more carefully than you did before. Blood pressure isn't your enemy. It's a messenger. When it climbs too high, it's giving you a warning. When it drops too low, it's giving you a warning too. Your job, together with your physician, is to read those messages with care. Now I'd like to ask you something. Share this video with that mother who's been on blood pressure medication for 20 years and has never had a standing reading taken. With that father who stopped his medication without telling anyone. With that grandfather who's already fallen twice in the bathroom and just chalks it up to age. This information may help prevent a fracture, a stroke, a hospitalization. In the next video, I'm going to walk you through 7 signs your heart may give before a serious event. Signs that many people confuse with ordinary tiredness or with simply getting older. These are signs that can appear months in advance, and when they're recognized in time, they may change the outcome entirely. You won't want to miss it. Take care of your blood pressure. It's the street through which life flows inside you. Keep that street in good shape, and your body may carry you a lot farther than you imagine.